Welcome back to the EAU podcasts, where we explore the latest advancements on and critical topics in the EAU Guidelines for Neuro-Urology. I'm your host, Christa Lips. In today's episode, we'll be discussing our new recommendations to measure heart rate and blood pressure during invasive procedures, including urodynamics, cystoscopy and colonoscopy, in patients with a history of autonomic dysreflexia. Autonomic dysreflexia is a condition that affects individuals with spinal cord injuries, usually above the thoracic 6 level. It is characterized by a sudden and potentially life-threatening increase in systolic blood pressure of 20 mm mercury or more, often triggered by a stimulus below the level of injury. To shed light on this topic, we have invited Professor Bertil Blok, Chair of the EAU Guideline Panel on Neuro-Urology and urologist in the Erasmus MC in Rotterdam. Welcome, Professor Blok. Let's start by addressing why heart rate and blood pressure measurements are essential during urodynamic and cystoscopy procedures in patients with autonomic dysreflexia.
Absolutely. Autonomic dysreflexia can be triggered by various stimuli, such as bladder distension during cystoscopy or urodynamic study. These patients have impaired control of their autonomic nervous system, which can lead to a rapid rise in the systolic blood pressure, potentially leading to stroke. The monitoring heart rate and blood pressure allows us to detect this potentially dangerous response promptly.
That is fascinating, Professor Blok. Could you explain how these measurements are performed during cystoscopy and urodynamic procedures?
Certainly. Prior to the procedure, a baseline blood pressure and heart rate are established. And during the outpatient cystoscopy and urodynamic procedure, continuous monitoring of blood pressure and heart rate is crucial. This can be achieved using non-invasive methods, such as an automatic blood pressure cuff and pulse oximeter.
And what are the specific benefits of monitoring heart rate and blood pressure during these procedures?
That's an excellent question. By monitoring heart rate and blood pressure, we can quickly identify autonomic dysreflexia episodes and intervene promptly. Prompt intervention is critical to prevent severe complications, such as stroke, seizures, or even death. And additionally, monitoring allows us to assess the effectiveness of any interventions we implement to manage autonomic dysreflexia during the procedure.
That is crucial information, Professor Blok. Are there any challenges or limitations when measuring heart rate and blood pressure in these patients?
Indeed, there can be challenges. Some patients have impaired sensation, making it difficult for them to report symptoms associated with autonomic dysreflexia. Additionally, certain medications they might be taking can mask the symptoms, making monitoring even more critical. It's essential to have a comprehensive understanding of the patient's medical history and individualized approach to monitoring and managing their autonomic dysreflexia.
Thank you for highlighting those points, Professor Blok. In conclusion, could you summarize the key takeaways for our listeners?
Absolutely. Monitoring heart rate and blood pressure during urodynamic and cystoscopy procedures in patients with autonomic dysreflexia is essential for early detection and timely intervention. It allows us to safeguard their well-being, prevent severe complications, optimize patient outcomes. By staying vigilant and responsive to their unique physiological challenges, we can provide the best care possible.
Thank you, Professor Blok, for sharing your expertise on this crucial topic. That concludes today's episode of EAU Podcasts. I hope you find it informative. Remember to join us next time as we delve into another fascinating medical topic. Stay tuned and take care.